Good day everyone, I'm Bernadine Blom. I'm a registered dietitian as well as a certified lactation consultant, and today I want to talk to you about nutrition during pregnancy. Most importantly, we're going to focus today on what we should be consuming and what we should be avoiding during your pregnancy. We want to try and include a variety of food, from fruits, veg, dairy, protein, starches, as well as our legumes. And this will ensure that we get adequate nutrients, specifically focusing on our iron, our zinc, our choline, our folic acid, as well as our calcium. I'm going to be focusing on 3 of these nutrients that is vital during pregnancy. First up is iron. Iron is important for that increased red blood development that you will be experiencing, as well as your baby's growth. We want to try and incorporate foods that is rich in iron, including our animal sources, from eggs to protein, so our red meats, our chicken, and so on. We also can include some plant-based food groups, including our spinach, our lentils, and our beans. But it's important to know that the iron from our plant-based food groups are not as bioavailable and easily absorbed in our body compared to those of animal food sources. Next up is folic acid. Folic acid is important for that cell development as well as development of your baby's spine. Having a deficiency in folic acid can result in birth defects of your baby's spine, and therefore we want to ensure that our diet is adequate in folic acid. Food groups includes lentils as well as spinach and fortified breakfast cereals. Next up, we want to focus on our calcium intake, which we know is really good for bone health as well as your baby's growth. Food that is high in calcium is generally our dairy, for example, our milk, our yogurt, but also can be found in things like our pilchards, and we want to aim for 2 to 3 portions of this per day. What we want to try and limit and avoid in our diet, first up, is any ultra-processed foods. Generally, we try and reduce our intake of our takeaways, as well as our chips and sweets, as well as cookies. We generally want to try and limit our caffeine intake to less than 200 milligrams per day. Caffeine can be found in coffee, black tea, chocolate, energy drinks, as well as Coke. And we also want to try and avoid any raw or unpasteurized foods, as this can increase your risk for foodborne illnesses. Lastly, we also want to try and avoid any spoiled foods. It's also important to talk about alcohol, as this should be completely eliminated during pregnancy. And if you are a smoker, I would highly recommend you stop smoking throughout your pregnancy as well as shortly after. Nutrition during pregnancy supports your baby and impacts them directly. We want to strive for a balanced diet as best as possible, and to ensure that your body is consuming enough nutrients and energy to sustain you throughout. Should you have any pregnancy complications, including anemia, blood pressure, and so on, it's important to reach out to your dietitian for personalized advice. Lastly, we want to ensure adequate supplementation to reach that nutrient needs. Happy eating!